refreshments in the back. So during the course of our time shared together, if you're thirsty, there's water in the back. If you need to get some fruit, you want to make sure you don't carve out. Fine. If you're working on building up your carbs, we have those over there. We have donuts. We have muffins. We just hope none of you fall asleep, have a knack attack in the process. I put that black bowl over there. If any of you want to kind of drop something in there, some of the people, brought in, maybe we can help defer the cost so that if we should do this again, one or two people aren't bearing the burden of everything going on. We're thankful to the Apostolic Ministries Church, AMP Church, for allowing us to meet here. I'm the pastor. My name is Kaleo Vayeu. I'm the pastor of Keaha Vineyard. One of the things that we've been kind of working through in our gathering is, what does God want? I mean, what does He want? When we get to the end of the road, I started about 35 years ago, so I'm more toward the end of the road than I am at the beginning of the road. But when we get to the end of the road, what is God going to be looking for? And in the last couple of months, working through the passage from the Gospel of Matthew, I think it's chapter 22. We have all the scribes and Pharisees, all these legal minds, arguing, about various issues of concern. And it's kind of like a food fest. And then they ask Jesus, what's the law above all other laws? What's the one thing we're going to be judged on, when we get to meet you again, when we get to meet God? And one of every now and then you see Jesus doing something different, like he starts playing with the dirt, with the finger. He kind of looks aside or thing. But this one, he just steps forward. It's kind of like the lion in the room. He just goes right for it. You shall love your God with all your heart, all your mind, and all your soul. And the second one is just as important. You love your neighbor as yourself. So if there's something God wants, is that we would learn how to love. So at the end of the road, did you learn how to love? This is really important for the kind of population that this gathering is called to reflect upon today. What do we do with individuals that struggle with emotional issues? I don't know how mood disorders, who find themselves substance abuse, all kinds. Well, how do we love them? Okay, because in the end, the Lord said, did we learn how to love? Okay, you can have 1 million people in the house, and if only one knows how to love, you're kind of in a bad house. So we've been exploring that issue in our own fellowship. And because of another number of conversation and a number of different gatherings, Alexandra and I were talking at one point, and what we're seeing right now is the culmination of that. I hope it won't be the end of it, but maybe it's something we can just break into. So I'm going to try not to take up all this time, and I'm going to hand the mic over to Alexandra. But before I do, could we pray? This second. Father, thank you for going ahead of us and opening the roads, making crooked paths straight so we could be here. And this is an awesome time, just knowing that you are here with us and you are opening up spaces where we can hear you, where we can see you, and we can feel the pulse of your heart. Father, we ask that with every inch of who we are, that you would fill this place, that you would fill us. Not just our minds, but Lord, that you would fill us with your Spirit, fill us with your love, and teach us through this time how we can be more like you. We want to be like you. Jesus, we want to be like you. Fill this time. We pray for your blessing and your anointing upon our speakers this morning, and pray that you would begin even now setting off little fires on everyone's heart and head this morning. We pray this in Jesus' name. Amen.
Hi, everybody. I'm Alex Love. My husband is one of the pastors at New Hope Maui, and I'm a licensed marriage and family therapist. I'm also certified as a substance abuse counselor and a sex offender treatment professional. I have a private practice in Wailuku that I do part-time, and then I've got kids at home that I do rest of the time. And most of the people that I work with are adults or adolescents. I have people all over the gamut, but primarily I'm working with men who have committed sexual offenses.
Hello. Okay. Hi everyone, I'm Mari Kanemura. I'm a licensed clinical social worker. I work at UH Maui College as a personal support counselor. And there I provide psychotherapy and counseling for the students who are in crisis, suicidal, anxious, depressed, or experiencing domestic violence. But I also have a private practice and work for a Christian clinic called Oloho Clinic. They're based out of Oahu. I'm here, so I'm the only one in Maui. And in my practice, I specialize with treating women, adolescents, children, in the areas of grief and loss, trauma, on the other side of what Alex does, so the survivors and victims of abuse and adjustment disorders.
Just kidding. Good morning. My name's Yvonne Manupuna. Like Alex, I'm a marriage and family therapist. I've got a practice in Kahului. My jam is really couples work, affairs, building healthy relationships, that kind of stuff. But I have worked in our community nonprofits with women in substance abuse, adolescent work with my youth and family services, that type of deal. And then others in my practice that focus on other things. So if you want to know more about it, you can pull me on the side later and ask me more. I think that's it.
Okay. Thank you, Yvonne and Alex. Okay. I think it's for the recording. Oh, you want it? Okay. Got it. It won't be for a while though. Okay. Okay. So thank you, Yvonne and Alex, for introducing yourselves. This is wait, can we go back to that other one? Just a program of what today's, for the next couple of hours, the plan of what how we're gonna break it down. Thank you, Pastor Kaleo, for that introduction as well, and the prayer. You just took care of number one. But there's bathrooms, I think, right through these corridors. And feel free, sometimes we're gonna get into it. So the topics today that I'm gonna focus on is depression, trauma, and anxiety. And there could be triggers that you may not expect, and how you're feeling, and you're kind of caught off guard by that. So feel free to get up, walk outside, use the bathroom, get something to eat. Just take care of yourself during the whole presentation as well. And Alex will come back, and she's gonna address the role of the church. you guys were, due to time, we're going to kind of transition quickly into the panel part. So you can take your own personal breaks throughout this instead of taking a 10-minute break throughout this workshop. And then so Yvonne will come back and join us for the panel portion, and that's a time for you, anyone as the audience, you can ask any questions you want, and we'll together try to come up with some kind of response. May not be an answer, but some kind of address that any question, and then we'll close, and there's evaluations at the end. Okay, so we can do the next slide. So you all have outlines, or some of you who walked in. There at this table. Chris, do you wanna, if you don't have one, raise your hand. And there's also a sign-in sheet there, so please fill that out when you have the chance. Everything you see up here is on your outline, so you don't have to worry about jotting notes quickly. I mean, you can write your own notes, but later on you can always refer back to it. So I'm gonna just kind of go over signs and symptoms of depression, anxiety, trauma. What are some of the causes, some of the statistics, prevalence, rates, and how to cope, or suggestions and treatments to these 3 things. So the first one is depression, and let's define that. So next slide. Depression is a persistent feeling of sadness and loss of interest or pleasure in the activities that you once enjoyed, you no longer enjoy. It's a feeling of worthlessness or guilt, interferes with your concentration, motivation, and other aspects of everyday functioning, as well as your appetite will change. So you don't feel like eating, or the opposite, you overeat. Okay, we're gonna continue. Next slide. You also, those who are depressed feel tired, fatigued, low energy. There's noticeable changes in their activities, so they could be moving or speaking slowly, or the opposite, talking fast, more agitated. There's thoughts that you'd be better off dead, and the symptoms must last at least 2 weeks for a diagnosis of depression. As a clinician, we have to rule out any other medical conditions like thyroid problems, brain tumors, vitamin deficiencies. They can all mimic symptoms of depression. Okay. So the prevalence and statistics. What does research have to say about depression? Well, it affects 1 in 15 adults. That's 6.7% in a year. And 1 in 6 people, or 16.6%, will experience depression at some time in their life. Women are more likely than men to experience depression, and 1/3 of the women will experience a major depressive episode in their lifetime. So this data is from the National Health and Nutrition Examination Survey, or the CDC. The prevalence of depression decreases as family income levels increase. So families in poverty have a higher risk of symptoms of depression. 80% of adults with depression reported at least some difficulty with work, home, and social activities. And that kind of goes back to that difficulty with concentrating and focusing on things. So what are the triggers and causes? Well, depression can affect anyone at any time, but on average it first appears during the late teens to mid-20s. There can be an imbalance of certain chemicals in the brain that may contribute to symptoms. Also, genetics or family history can also increase the risk of depression. Other external causes are like stress, anxiety, also low self-esteem. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Okay. causes of depression found in the Bible. You can do the next one. There's actually many examples of depression found in the Bible too, but I just kind of picked out a few. So Jonah displayed anger at God for being unfair in not punishing evil people that have repented. Matthew 27:3-5. This is Judas. Regret or remorse for sinful decisions or actions made, and bitterness over God for not being fair in the innocent. Job and his family, that he lost his whole family, but then God blessed him with a new family as well. And not appreciating what you have until it is lost or taken away from you, and that's Genesis, referring to Esau. Okay. So next slide, excuse me. Wanted to start off with depression because I feel like that kind of overlaps a lot of areas in mental illness. It can carry over in, I guess, like kind of like a dual diagnosis or other aspects, you know, just like having depression and anxiety, or depression and something else, like in bipolar, you know. So also here are some other kind of examples, like grief or loss, a death of a loved one. Grief isn't just death, but it can be any change or transition in your life. So moving, changing jobs, something happy like graduation or getting married, but there's still some level of loss there. You're no longer single. Now you have to figure out what you're going to do now that you graduated. So you're no longer a student. So there, even in the happy, there's still something to address as far as to bring healing and to grieve. So there you'll see symptoms of depression in these areas of, but it doesn't necessarily mean that you are diagnosed with a major depression or something like that. That's all I'm saying. Personality disorders as well will have some overlap of depression symptoms. So there's a few up there: antisocial, personality avoidant, borderline, dependent, histrionic, narcissistic, obsessive compulsive, paranoid, schizoid, and the schizotypal. Okay, so treatments for depression may involve dealing with all areas of one's life. So looking at the whole picture of them in their environment, their thoughts, emotions, and their behavior. In general, many depressions respond to cognitive types of counseling and may be less intrusive than medication, because we all heard of antidepressants. That is okay if some people cannot break out of the depressive cycle, you know, I guess naturally or without any kind of, they may need that they may benefit from a trial, I guess, of antidepressants, which can help the chemical balance, so that when they do try to do self-care or change, make changes in their life, it has a bigger impact and lasting impact, maybe with the medication. But that's, we usually don't recommend medication right away from the beginning. And by the way, none of us can prescribe medication. We're not doctors. Only doctors or psychiatrists who are medical doctors can prescribe. But if you do take any medication, it's important to note that that in itself is not the answer, and that doesn't mean that you stop counseling. In fact, you need to continue the counseling, because together it's you'll get the most effective results. Some suggestions on how to cope with depression. Well, oftentimes it's giving yourself or giving that other person like permission to grieve, or allow time or space to grieve. You can keep a journal to get your thoughts onto paper, and it's also a way to review the process or your progress in healing. Sometimes you just have to, like I said, you're holding it all in, just getting it out, and then trying to do the next thing that you want to do or get to. You can also create a schedule for yourself. Next slide. when someone's depressed, it's something, just waking up in the morning can be really difficult. So if you make a schedule, say 7 a.m., I'm going to wake up, get dressed, 8 o'clock, I'm going to do devotionals and have my coffee. So, and you stick to that schedule, then that can also just give you enough to kind of get you out, literally out of bed. When I worked at a hospice on Oahu, we had these walk in the mall programs for bereavement support groups, and it started at 8 o'clock in the morning in the mall, like Pearl Ridge, Kahala, the air-conditioned malls. And it's an informal support group, but the whole idea was to get you out of bed, first and foremost, get you here. And then it was about just seeing that you're not alone, that everybody is somewhere in their grief journey. And then you're actually walking, so you're getting some kind of physical exercise which is good because it gives you natural, like the antidepressants, but it's natural, it's endorphins, so it boosts your mood. So all of that is strategic, so sometimes you have to trick yourself, and that's what that schedule is for. Making a list of activities you enjoy when you're not depressed, and you try to do at least one of those activities each day. So this is the cognitive therapy part, where you change depressive thoughts and beliefs. So before, you may have told yourself, you repeated to yourself, I'm a sinner, I'm terrible, and what does that result to? More depression. Versus confessing your sin and saying, and God, knowing and receiving God's forgiveness, and now you can forgive yourself. Okay, so how can you help? Okay, you're not alone, there is hope. Proverbs 13:12, hope deferred makes the heart sick, but desire fulfilled is a tree of life. Being a good listener, which first thing I put, maintain good eye contact. That's really hard, I think, in Hawaii for local culture. Or I know when I was growing up in the Asian culture, you don't make eye contact because that's a sign of disrespect. So when I went away to school in Oregon, whoa, it was a huge wake-up call. Like, everybody's staring, and it's really uncomfortable. But then you kind of have to, then you realize, actually it's a good thing to make eye contact, good eye contact. And it just kind of shows that you're being an active listener. And when you're an active listener, you don't talk, so you don't give answers, you don't try to fix the problem, but you just listen and practice the silence, so you can kind of role model that, and summarize what the person shared, so that they know, like, oh, you were listening, you did hear me, or no, that wasn't what I said. So then they can kind of clarify, so that way it's like you can see if you heard or understand them correctly. And you can ask short questions for clarification. So again, there's no answers there. That's what being a good listener looks like. And also, finally, you can refer or seek professional help when the sadness or depression continues at a deeper level. Don't have to wait for 2 years. I mean, but that is, like, I guess, one of the criteria for a diagnosis. But definitely, if it's not getting better and the depression is interfering with your daily functioning, so like going to work, going to school, your relationships, if you're having suicidal thoughts or thoughts of harming yourself, and there's a greater need beyond the current support you're receiving. Okay, I forgot to start my clock. Sorry, wait. So so that was depression, and then I am going to move into anxiety next. Is that what's next on your guys' outline? Okay, good. Depression and anxiety. Okay, so signs and symptoms of that, it would be anxiety is excessive worry, difficult. There's worry and fear are constant and overwhelming, and it can be disabling. So feeling restless or on edge, and all that takes up energy. So you're just wiped out, and you're basically fatigued. There's difficulty concentrating because you're constantly worrying about, fixated on something. So a lot of these kind of sound like, oh, that could be depression, but maybe it's anxiety. Well, maybe it's both. Okay, so moving on. Some other signs and symptoms of someone, if you're anxious or if who's experiencing anxiety, is they're irritable, there's muscle tension, there's difficulty falling or staying asleep. Also distress or impairment in social, occupational, or other areas of functioning. And the symptoms are not due to medication, drug abuse, or other mental disorder. Okay. Statistics and prevalence on anxiety, according to the ADAA, Anxiety Depression Association of America, is that anxiety disorders are the most common mental illness in the United States. 40 million adults, or 18.1% of the population annually, but only 36.9% of those 40 million adults or receive treatment. Nearly one half of those diagnosed with depression are also diagnosed with an anxiety disorder. Women are twice as likely to be affected as men for the following anxiety disorders. So there's 6 here, and 4 of them are predominantly women. Generalized anxiety disorder, panic disorder, specific phobias, PTSD or post-traumatic stress disorder. And what's equally common among men and women is social anxiety disorder and obsessive compulsive disorder. For children, 25.1% of children between the ages of 13 and 18 years, so that's teenage, preteen years, have an anxiety disorder. And if untreated, children perform poorly in school, miss out on important social experiences, and are at a higher risk to engage in substance abuse. So some of the triggers that cause anxiety, again, environmental stress and life events. So work, school, home, relationships, all the things that we do in life, can trigger that stress. Finances, trauma, death of a loved one. There's also changes in your brain. So if there's been findings of faulty circuits in the brain that control fear and other emotions. Also genetics. So if there's a family history of anxiety, you have a higher risk of anxiety as well. So some of the treatments and recommendations, well, good news for anxiety disorders, they are highly treatable. So there's also medication that antidepressants like Lexapro and Prozac that can work for both depression and anxiety, as well as low doses of antipsychotic drugs, Xanax and Klonopin for panic attacks. Psychotherapy is another treatment where you just talk. I mean, it sounds like a big word, but it's just really like talking, processing, breaking it down, getting to the root, understanding and identifying and making modifications to manage anxiety. Okay, more tips to lower anxiety. You can take care of your body. So that's like nutrition, your intake, there's good stuff back there, but we got to balance it out with some fruits and vegetables and some, nutritious food, as well as the exercise. So find something you enjoy doing. If you like the gym or if you like outdoors, we have the ocean. We're blessed with that. We got the mountains. Make sure you don't get lost hiking. But and then rest, sleep, taking naps. Like your body needs that. Your brain needs that. It's good after all that hard work. Limiting alcohol, caffeine, and sugar as well, and of course prayer. Having that devotional, quiet time daily. It doesn't mean that you have to do it for like an hour a day. I mean, even if it's just 10 minutes a day where you just set time, and like some people like to meditate. I mean, I fall asleep if I do that. So I like praying, I like journaling, and it could be in your car, even when you're driving. I mean, the three of us are all moms, and it's like, when do we have time to do anything for ourselves? Well, I find a lot of time in the car and driving. I can talk to God, you can be creative. More tips to lower your anxiety. So identifying what you have control over and letting go of the things that you don't have control. Because anxiety, that's a big part of it, is that fear of the unknown. You want to be able to know exactly what's going to happen, and that's what's eating you up. So the anticipation is worse than the actual event. What's a good example? I guess like first day of school, I guess we can use that. The kids just went back to school, and and so I don't know if they're all they're worried about what's my teacher going to be like, who's going to be my friends, what is it going to be, and then when they actually get there, just get them there, and then they're like, oh, it's not that bad. How was your first day of school? It was actually fun. Okay, so all that worry for what? And did it help the situation or make it better? No, it didn't. So if you can just kind of get yourself to just don't control over that part, but I do have control over the beforehand, the anticipation, to just breathe and get yourself there, and it's not going to be that bad. So Matthew 6:34 reminds us, do not worry about tomorrow, for tomorrow will worry about itself. Each day has enough trouble of its own. Keep a journal or log, again, of the times you feel anxious, and then you can discuss that with your therapist in psychotherapy, where you just talk. More tips to lower your anxiety is to practice daily self-care. And self-care is not selfish, it's life-giving. It should make you smile, it should bring joy. It'll lower your stress. So things you like to do, here are some examples. Surfing or gardening, cooking, spending quality time with family or friends. Usually I'll make you guys write a list out of your own, but due to time, I'm just kind of giving you some ideas. Listen to music, play a musical instrument, or coloring books for adults. Where did I have that? Here. You all seen these? These kind of like coloring books? No, nobody. They're. I don't know, I saw them several years ago at Ross, and I was like, wow, this thing is so cool. Coloring to relax and free your mind. And then they started popping up everywhere. Then they're like at Barnes & Noble and Costco. So okay, there's something here. And I think they even talk about anxiety in the very beginning. So I made some copies there, and there's some pens. Feel free to take some home, work on it now, and it's portable. You can put it in your bag, take it with you wherever you're feeling stressed. You know what? I'm just gonna start coloring. You get into this space and this place, and my theory on this is that coloring books, you think of, it's children, right? It's for kids, crayons and cartoon-looking coloring books. But you remember what it was like in your, when you go back to that time as a kid, and you could just color outside the lines and color whatever you want, and free spirit. I mean, no stress, no, none of that. So I think it's kind of like connecting in your brain to take you back to that time and space and place where you just had no worries, no cares. You could just be in that moment at least, and not fixate on all the other stressors. Okay, so that's anxiety. Okay, good. I think I'll be okay. So last one is on trauma. Next one. Trauma here. Definition of trauma. Trauma occurs when there's a sudden, unexpected, overwhelmingly intense emotional blow or series of blows, assaults that that assaults the person from the outside. So the overwhelms the usual capacity to cope, can be a debilitating sense of loss of control and feeling utterly helpless. So the next slide gives you some examples of traumatic events, and this is the list can of course be a lot bigger, but here's just some. So natural disasters, obviously, like fires, earthquakes, hurricanes, tsunamis, interpersonal violence, rape, child abuse, car accidents, all these accidents and acts of terrorism, war. You see a lot of veterans that have been exposed to trauma, right? So that's where you hear of the term PTSD. But even a breakup or divorce, any kind of situation that's significantly humiliating, suicide of a loved one, even surgery, falls, injuries, death of a loved one, or diagnosis of a life-threatening or disabling condition. The event can result to a longer-lasting emotional and psychological trauma if the event occurred during the childhood years, or if the event occurred repeatedly, such as child abuse. And it's also important to note that other less severe but ultimately stress-inducing situations can also trigger traumatic reactions to any individual. What are some signs and symptoms of trauma? Cognitively, there's thoughts of reoccurrence, there's nightmares, memory loss, difficulty concentrating, confusion and disorientation, and mood swings. Behaviorally, in your behavior, you'll see someone very common to avoid the place or activities that trigger the memories of that traumatic event. Social isolation, they'll retreat and withdraw and have a lack of interest in the previously enjoyable activities. Physical signs of trauma is that you'll start, the person will feel anxious, fatigued, tachycardia, so having irregular heartbeats, edginess, insomnia, difficulty sleeping, chronic muscle patterns, sexual dysfunction, changes in sleeping and eating patterns, vague complaints of aches and pains throughout the body, extreme alertness, always on the lookout, so they're for warnings of potential danger because they're on edge, right? Psychological symptoms of trauma is that there's an overwhelming fear, obsessive and compulsive behaviors, detachment from other people and emotions. So you see the physical, we just talked about that, they're isolating, they're avoiding, and this is a psychological, I guess, connection, that detachment, that emotional detachment from other people, emotional numbing, depression, guilt or survivor guilt. It was one car accident, we were all in the car, but why am I the only one that survived and I can't be happy? It's not fair. And so that's what survivor guilt is. Shame, emotional shock, disbelief, irritability, anger, anxiety, and panic attacks. Some signs and symptoms of trauma that are specific to children, because oftentimes, children, they can't articulate what they're feeling. I mean, even adults have a hard time doing that. So children who are not even talking yet, but here are some signs that you can see, something's not right, and they may be having nightmares, flashbacks, wetting the bed, panic attacks, intrusive thoughts, being aggressive, exhibiting aggressive behavior, sexual reactivity, extreme clinginess or refusal to be alone, and there's just significant behavioral changes. It's like, your child and they're like, they're acting out of character, out of who they are. So there's a lot that we can go into for trauma, but I'm gonna focus a little more on the brain. So I think that was something that Pastor Kaleo was interested in. So let's look at the brain. The next slide gives you a picture of the brain. So So let me just share a little bit about this. Let's see. This is a study done in 1996 where participants read a narrative of their own traumatic experience during a brain scan or a PET scan, PT. First of all, there was increased activity in the right brain, so mainly in the limbic system and the visual cortex. That's on the bottom. You see where it says limbic system, and that increased. That controls the memory and your basic emotions. There's a decreased activity in the anterior cingulate cortex, and this is the part of the brain that moderates that limbic system. So, okay. Decreased activity in Broca's area, or a part in the frontal lobe up there on the left. And this helps with the semantic processing and articulation of speech. So if you when, like, everybody reacts in crisis differently. Some people are like screaming their head off, and some people are just frozen and they can't move, they can't talk. That's kind of what happens here, is that there's that decreased ability to communicate thoughts and feelings. Speechless terror is felt during trauma, or therapy may be caused by decreased activity in this area of the brain. But there is a third person in that situation of crisis where they're able to help others and stabilize the situation. And then once the situation is stabilized, then they can process and freak out on their own. That's usually what happens. But there's three types. Patients exposed to traumatic reminders experience an increased cerebral blood flow in the right medial orbitofrontal cortex, which refers to the appropriate social emotional responses. Insula is the social emotions, amygdala controls the basic emotions, and the anterior temporal pole controls language. When people are reminded of a personal trauma, they activate brain regions that support intense emotions while decreasing activity. Memories of the experience may be dysfunctionally stored in the right limbic system indefinitely until the event has been processed fully. So this can produce images of traumatic experience, terrifying thoughts, feelings, body sensations, sounds, and smells. Okay, next slide. The impact on brain development, for kids who experience trauma, is that kids who suffer from neglect go through traumatic stress that impairs their development of the right brain. And this can result in neuron damage and atrophy. Atrophy is where it actually dies, that part of their brain. So kids, they don't deal well with stress, or develop the ability to regulate their emotional response. They may not develop empathy, and neglect and abuse can lead to antisocial behavior. Okay. There's a higher tendency, and do you guys know antisocial? It's not like where you don't want to socialize. It's like they're destructive behaviors, and disregard rules and respect. So there's that lack of empathy. Higher tendency to lash out violently due to trauma. There's a higher tendency of violence affecting, and that's because it affects the amygdala from growing, and that amygdala controls your emotional responses. But if it's not growing, then that child has a difficult time controlling their emotions. Okay, so some treatment. Here's a few that I wanted to highlight. And exposure therapy, it's driven by experiential learning through exposure techniques. So the client would systematically engage the two avoidances, so like the memory of the trauma and the reminders of the memory, and then they're guided to this throughout this process of exposure. Cognitive behavioral therapy, it involves that process where you evaluate your thoughts and feelings about the traumatic event. So here's another example where you can write down the narrative of the traumatic event and then be able to process and break it down even more completely. EMDR, or eye movement desensitization and reprocessing, that one, it incorporates elements of the cognitive behavioral therapy with eye movements or other forms of rhythmic left to right stimulation. And it's sort of like, I think, desensitizing triggers associated with the traumatic memory. So the reprogramming part, reprogramming new associations between the traumatic memory and with more adaptive memories of information to eliminate emotional distress. And there's been studies that have seen veterans, that this EMDR is very effective with veterans who have experienced trauma on the battlefield in war. Okay, so that is my portion. I'm going to call Alex back up here. We're at 9:56. Okay. So thank you. Again, feel free to take a bathroom break, water break, snack break, coloring break anytime. We're just going to power through.
Hello? Okay. Okay, I'm going to be talking about the role of the church. What should the church be doing to help or to serve people who are struggling with mental health? For my presentation, I have kind of 4 areas that we're going to go through. The first area is pray. The second is provide first aid. The third is don't over or under spiritualize. And the fourth is action time. So we need to start with prayer. First, be praying for God to reveal the sin in your own life. Start with yourself. There's a saying, counselor, know thyself. And the reason that we have that saying is because when we can't see past our own stuff, we may miss something for somebody else. We may excuse something for somebody else. We may be too uncomfortable to address something for somebody else. And we see this in Scripture too. Luke 6:42 says, how can you think of saying, friend, let me help you get rid of that speck in your eye when you can't see past the log in your own eye? Hypocrite. First get rid of the speck in your own eye, then you will see well enough to deal with the speck in your friend's eye. You don't need to be perfect, but we need to know what our stuff is so that we can see well enough. Nobody is ever going to be perfect. So that's not something that you need to be concerned, like, oh, I still struggle with this, so I can't help somebody else. No, maybe you are uniquely suited to help that person because it's something that you struggle with. But know your stuff. I've heard of people who grew up in very, very abusive households, and then maybe later down the line they're talking with somebody who's talking about being verbally or emotionally abused, and they may say, well, if it ever gets physical, then you need to do something. No, verbal and emotional abuse is very important. If it's worse, if it's not as bad as what you've been through, that doesn't mean that it's something to excuse. We need to know our own stuff. So next, pray for discernment. Be asking God, what are this person's real needs? What really needs to happen in this situation? Am I the person that you're calling to help in this situation, in this family, in this person's life? Praise the Lord, He's made us all different. We're all unique. We're different parts of the body. And so just because somebody is at your front door doesn't mean that that's the person for you to be dealing with. That's not the person for you to serve. Maybe you know somebody else that can be better, that might be better suited to help that person. And it's good to know what the real needs are. In preparing for this, I talked with a woman from our church who's been very, very open about her struggle with mental illness. And she was telling me about a time when she was really struggling with anxiety. She was anxious about where she was going to live and about transportation, and it was just consuming her. And as soon as she secured stable housing, and as soon as she got her car fixed, her anxiety was reduced. So we don't need to make things bigger than they really are. Sometimes the person's real needs are, they need rent for the month, and they don't have it. Maybe you are a mechanic, or you know one that could do the car work for them, and perhaps that would be a way to meet their real needs. So for first aid, I adapted this from the American Red Cross, so some of them are a little bit, goofy, but go with me on this because it's just a strategy for examining what's actually happening here and what are the appropriate steps to take. So, first step, before you administer care, check the scene. Check the person. Size up the situation and form an initial impression. Is it safe? What happened? How many people are involved? Are there children involved? Is this an entire family? Is this just a single individual? And is anything life-threatening going on? Is there a risk of suicide, of homicide? Most of the time, people can withdraw from drugs safely, but there are some withdrawals that can be deadly, specifically alcohol and benzodiazepines. Those can cause seizures, those can be deadly. So if somebody is trying to come off alcohol and they are a serious alcoholic, it could be a life-threatening situation. Okay, so let's say that the person isn't oops, I'm sorry, where am I at? Let's say that the person, I'm getting blown around over here. Okay, let's say the person is responsive, sorry. And there are no life-threatening situations. Maybe this is somebody that just showed up at your church and they're struggling with some stuff. Nothing life-threatening, and they're open, they're responsive. First, get consent from them. Introduce yourself. Let the person know who you are, maybe what you might be able to do to help them. Build relationship is what this is about. Get to know people. Let them get to know you. You could be the purest heart since Jesus Christ, but don't expect somebody to recognize that at first meeting. Take time for them to get to know you, and don't be discouraged if you offer something or you're willing to meet with them or you'd love to have them come to your small group and they're not open to that. It's okay. Keep building relationship. Keep building trust. Get help from others if necessary. Again, maybe you're not the right person. Maybe there's somebody else who could be a better fit. Involve other people. Use appropriate PPE, personal protective equipment. For first aid, this is like gloves and stuff, but for what we're talking about, this is putting on your spiritual armor. Being armed with scripture so that when you give counsel, it's wise, scripturally based counsel, not just worldly encouragement like, God would never give you more than you can handle. Not scriptural. Don't say things like that. Paul probably couldn't really handle being beaten or shipwrecked or in prison for all that time. God gave him more than he could handle, but it was through Christ he was strengthened and was able to endure. So make sure that we're not saying goofy things that aren't really scriptural. And then physical protection. I want to be really clear about this. Most people struggling with mental illness are not dangerous. Their behavior may be erratic, it may be confusing, it may be inappropriate, but most people are not dangerous. But let's be wise. So if somebody is struggling with drug addiction and they live in a drug house and you'd like to get together with them, maybe you're not going to go to the drug house to get together with them. Maybe you're going to find some neutral territory, a place that's not triggering for them. I got together with a homeless girl, and I had in mind where I was going to take her to lunch. She did not have that place in mind. That would have been a triggering location. So we had to drive a little bit farther, and we went to a place that she was comfortable. So think of places that are going to be safe. Now, in my line of work, I work with men who have actually hurt people. So I keep military-grade pepper spray under my desk. Sometimes we do need to have actual things that can protect ourselves. But usually we can be safe if we change the setting or make sure that we're thoughtful about that. Next, interview the person. Again, this is building relationship. Get to know them. Are there triggering events? Are they in a psychotic episode because they've just lost their housing? They were evicted? Is somebody depressed because they went through a really nasty divorce a couple of years ago and they're having a hard time moving on from that? Were they just dumped? Were they just fired? Find out what's really going on. Maybe we can help with some of that little stuff or big stuff, or it might give us a little bit more context about what's happening for them. Assess for all of their needs from head to toe: physical, spiritual, emotional, relational. What are all the needs that this person has? And then let's see how we can begin chipping away at that. Again, involving other people or other groups. And provide care consistent with your knowledge and training. Today, we're not handing out PhDs. So this is a very general conference. We're giving you some little tips and ideas, and maybe this will branch off into something where we can be more specific. But don't expect that you're going to be the expert on all things just because you showed up here today. Mari talked about medication. Some of us have ideas about medication. Maybe essential oils have really helped you. Maybe getting out and hiking has really helped you. But if you don't have an MD, if you're not a medical doctor, please don't be making suggestions about how people should change their medication. Maybe your dad had a bad experience with Paxil, but that doesn't mean that it's the wrong medication for this person. Now, if somebody is telling you about side effects that they're experiencing, things that are really bothering them, encourage them to go talk to their doctor about that. But don't be saying, oh, yeah, get off of that stuff, that's bad. Let them deal with that with their doctor. All right, moving along. Okay, let's say the person isn't responsive. Listen, not everybody is willing to or able to receive help. Continue building trust. Don't be discouraged. Just keep building trust. Ask more questions so that you really understand them. Maybe the way that you wanted to help wasn't the way that it's going to help. If you've got somebody that can't get out of bed in the morning and you're saying, listen, I can help you find a job, you're jumping into the deep end. You need to start a lot earlier. Start with, I'm going to come by and I'm going to get you up. We're going to go walk the mall, like Mari was talking about. We're going to go do something together. Or I'm just going to come to your house and sit in. Maybe they're not even willing to do that. Maybe they're willing to take a phone call or receive a text message. Start where they're at. Meet them there. And like I said, ask more questions. Understanding is different than agreeing. Some people have some really untrue, false beliefs, warped thinking. You don't have to agree with what they're saying. Understand where they're coming from and look at what their heart is saying. Look at what their intention is. Sometimes people are trying to meet their needs in ways that are really, really unhealthy, really damaging. But if you can look at them and see that they're trying to meet a certain need, we can have less judgment about the way that they're trying to do that and more compassion. Sometimes we need to refer to an outside source. We need to call 911, the suicide helpline, or refer people to professionals in the field. And lovingly respect people's autonomy. If they're not there and they don't want your help, as long as there's nothing dangerous or life-threatening going on, that's okay. Let them be. Let them be. Keep the door open, though. Sometimes we're offended and we close the door. We say, oh, you don't want my help, you don't want my help. No, keep the door open so that if they do decide that they're ready to come around, they know that you're still there. If the person is breathing, get other people involved. Maybe they're not super responsive, but they're breathing. Get other people involved, maybe family, friends, people known to the individual. They might have more ideas or information for you. Maybe they know something that worked in the past or something that really didn't work in the past. Change the person's position. Maybe you've got housing that you can offer that would be more stable. Maybe you've got a connection for a job or work that you could pay somebody to do for you. That may be something that gives them hope, getting them out of a bad situation. Are their surroundings making things worse? I'd like to put in a plug here for encouraging people to foster children. If you have a heart for kids, consider being a foster parent. You might be able to change a kid's situation, get them out of something, get them out of a group home, get them out of, maybe they're placed with an aunt or an uncle that's also not a good situation, and you might be the answer to their prayers. Now, if the person is not breathing, this is an example, maybe somebody is actively psychotic. Maybe they're intoxicated or withdrawing. For some reason, some other reason, they're lacking presence of mind. Now, most people who are mentally ill, like I said, are not dangerous, but some are, and it's hard to reach somebody who's actively psychotic. I'll tell a story in a little bit about that. This might be the time to get professional help. Sometimes somebody's really disruptive or threatening or unstable, and the police are the best people to call in that situation. Continue assessing for signs of life. This is important. Maintain connection. Don't give up. Be ready when the person is ready to come around. Someone may have denied your help in the past, but that doesn't mean that they're always going to deny your help. So I've got a story. There was, when I was young in high school and I was in youth group, one of my youth leaders, he was in his early 20s at the time, he was a youth leader. So for years and years and years, we went to the same church. I went away for college on the mainland. I came back home. I was on Oahu. And during that time, over the years, he had developed a bipolar disorder. He was in a hypermanic state. He was psychotic. He came onto our church campus and was threatening the pastor and saying he was going to rip out his throat, eat his brains, and tear out his heart, and just, stuff that was so off the wall and so uncharacteristic of him that they had to call the police. He was dangerous. He actually tried to physically attack the pastor. Somebody tackled him, and then they called the police. What did they do to follow up, though? Slapped him with a TRO, restraining order. Can't come back on church campus for a year. Can't contact the pastors, any of them. During that year, he came back to himself. He was no longer psychotic. He was no longer hypermanic. Actually, now he was in a depressed state, and he was drinking to cope. What was really, really sad was having him ask, "Am I allowed to go back to church?" Nobody had followed up with him. They were offended by his behavior, and they dropped him. This is not the way that the church should handle these sorts of situations. Maintain connection so that when the person is safe, they can come back. Now, we can't have people coming in being unsafe, attacking. We're not being called to allow that to go on. But there needs to be connection. There needs to be contact. He was really hurt. So one day I went, he's like, "I think I can go back. The TRO is up." I picked him up. He was drunk. He got in my car, and he was drunk. He was so ashamed. That was the only way he could get himself to church, was to be intoxicated. He wasn't inappropriate, but he smelled like alcohol. It was really heartbreaking. Let's not do that to people. Okay, moving on. Don't over or under spiritualize. People always want to know, is it spiritual? Is it mental? Sorry, I don't have the answer you're going to want. It's both. It is usually both. I was talking to Candace. She said she's only seen a couple of times where it was strictly one or the other. For the most part, it's a combination of both. People are going to want to know, is it physical? Is it spiritual? Let's take time, slow down, talk to people. We only know what they're dealing with when we know them. So take the time to get to know them. Pray for discernment while you're taking that time to hear them, to listen, to understand. Like I said earlier, in preparing for this, I spoke with a woman from our church who's been very open about her struggle with mental illness. And I asked her, what do you think the church needs to know? And she said, avoid well-intended but soul-crushing advice. She's heard people say things like, you just need deliverance. You just need to let go and let God. Just trust the Lord more. Do you think that people who are hurting are not trying that? They're desperate. They're asking God. They're begging. Maybe some of you can relate. I can. I've had breakdowns with my kids, and I'm like crying on my floor. Please, God, help me. I'm going to kill them all. Help me. We can relate to being in a place of desperation and begging for God. And you know what? I prayed and my kids didn't act right, and I still kept crying. God doesn't necessarily swoop in and save the day. That's not always the way that he works. So telling people they just need to pray more, or just, you love your demons, so that's why we prayed for deliverance and they didn't go away. She just loves her demons. No, maybe there's something else going on. If you've done deliverance with somebody, if you've prayed with them, if you've casted out demons and something is still going on, maybe it's not just spiritual. On the other end, if somebody has been in therapy for years, and if it's a good therapist and not somebody that's just collecting a paycheck, and they've been working and they're going to the support groups and they're doing everything and it's just not there, maybe it's spiritual. Maybe they need some additional care in that area. This is why I'm saying it's usually both. It's usually both. So we can combine we can combine counseling and Christianity so that we're alert to sin issues that might be exacerbating a problem. So imagine this. You've got a woman who's depressed. She's seeking connection. She's lonely. She's isolated. She's desperate for love. And she's sleeping around to try to get that connection. She sleeps around. She has a moment where she feels wanted, desired, precious, loved. Ultimately, it ends up making her depression worse because she's shame. She's back to being lonely. She's maybe discouraged. She was hoping that this might land her in the marriage that she's hoping to find, and it's not getting her there. So we sometimes, in our attempt to meet our needs, we do things that are sinful. We do things that might be making our problem worse. So be attentive. What are the sin issues? And then how do we help people cope? We can help somebody develop insight so that she has like this aha moment. Oh my goodness, I've been trying to find love and connection and value in bed with all these men, and I'm not getting there. It's making things worse. Aha. Well, now what? So now we need to help them find coping skills that are actually going to help them meet those needs in ways that are healthy and appropriate. Maybe the way that the church can do that is by getting together with them, inviting that woman over for dinner with you and your family, having her come to your small group, or helping her find another small group that might be better suited for her, getting her connected with the women's ministry so that she's having people that genuinely love and care about her and want her best interest, and that's going to sustain her and help meet her needs. Let's see. Now, when people come to our churches and they don't behave appropriately, at our church, we're right on Market Street. So there are a lot of people who don't have homes and aren't mentally sound that come into our church. Usually they just get their coffee and their snack and they're on their way. But sometimes they come in loud. Sometimes they come in agitated. Sometimes they come in aggressive. We had somebody, I was in the nursery so I didn't see it, but somebody had forgotten to bring the refreshments that week, and one of our people he's a regular attender, but he's homeless, he was upset and went up on stage to let everybody know that they should have refreshments today. He wasn't happy about that. Well, what I loved about what happened in that situation was that he was lovingly ushered out by one of the men and taken to McDonald's, where he was given some food. And somebody else, Candace, I think, said that she let him know, we want you here, and if you're ever hungry, come talk to us and we'll get you some food. Don't do that again. If you need something, we'll take care of you, but you don't need to go up on stage about it. So look for, I'm saying all of this, but I think we need to be cautious about how we speak about people. Are we honoring them? Are we looking at them as a problem? Somebody that's too disruptive, regularly disruptive, not making progress like we'd like to see, loving their demons too much to give them up. Are we looking at people like that? Or are we seeing them as people who are created in the image of God, parts of the body? So let's be cautious about how we use people's stories. Are we using them for entertainment? Oh my gosh, did you hear what happened last weekend? You weren't there? Oh, let me tell you about it. It was crazy. Are we talking about people that way? Or are we honoring people? The language that we use to describe people who are mentally ill, are we calling them the crazies, the nuts, the psychopaths? Are we using those types of unkind, mean, hurtful, divisive, stigmatizing language? Or are we taking time to see that they actually can be part of the body if we make room for them, and that God is doing something in the midst of their mental illness? Are we taking the time, stepping outside of ourselves and what's comfortable, and doing that? That's what we're supposed to be doing. The church is supposed to be for everybody. Jesus said, this is the place for the sick. It's the sick that need the doctor, not the healthy. So the church is supposed to be the place for that. There's a saying, if you feel safe leaving your purse on the pew, your church isn't doing its job. I love that. I never feel safe leaving my purse out at our church. Never. I don't feel safe letting my kids sleep in certain areas. It's like, not safe. Good. That's what it's supposed to be. Action time. Get right yourself. If you want to be somebody, if it's in your heart to serve, if you've got somebody around you in your midst that you'd like to be helpful with, you'd like to minister to, get right yourself. Again, you don't have to be perfect. Nobody will be. Nobody's ever going to have, I talk with people about parenting all the time, but I just told you about a story when I'm having a breakdown on my living room floor and crying because my kids can't act right? I'm not perfect. Nobody will be, but you could still be helpful. However, work on your own stuff. If you'd like to do premarital counseling with a couple, but you can't remember the last time that you had sex with your spouse or had a nice date with them, don't take on that couple. Get right yourself. Make your marriage right. Eat right. Exercise. Deal with your own substance use. Deal with your own porn use. Get right yourself, or at least be working on it. And the reason for this isn't to I got all that issue, I got that issue, so I guess I can't help. No, you're going to be a target of attack from the enemy when you're doing kingdom work. So get right yourself. Why do so many pastors fail? Why are so many pastors addicted to pornography? Why are so many pastors in romantically dead relationships? It's because they're serving. It's because they're ministering. They're so busy taking care of everybody else that they've forgotten the commitments that they made to their own spouses. Don't be trying to counsel somebody about how to help their kid if your kid doesn't know you. Get right yourself, because you're going to be a target of attack, and you need to be strong, and your families need to be strong. Next is to be in it for the long haul. People don't make changes overnight. Sometimes they do. My testimony, God changed me overnight. Drastic. I had an eating disorder, and God rescued me. He pulled me out of it overnight. But there were times when I went back to struggling. It didn't have the same hold over me as it previously did, but there were times in life where I struggled. We're flesh. We're human. We're gonna have problems. Be patient with people. You might be giving your best to somebody, and it's really frustrating when they go back to drinking. You had 99 days of sobriety, and on your 100th day you relapsed. That's what happens. People are about to meet milestone, and they blow it. That's part of the process. Expect it. And accept it. Paul, after his conversion, he goes away for a couple of years. He was a pretty bad guy. I'm thinking God needed to do some work in him and in his heart to get him to the place where he was able to lead. I like this other saying, you can't hike 10 miles into the forest and expect to get out in 5. It takes time to recover. People are going to make mistakes. It's not their failure. Sometimes I guess maybe it's their failure. It's usually not your failure. Sometimes maybe it is your failure. Maybe you should have been there. Maybe you should have seen something. Maybe you could have helped. But expect it. It's just part of the process. Learn from it. Move on from it. Have available resources like Celebrate Recovery. Maybe your church isn't equipped to deal with that. Although I'd like to put in another plug that I think that our churches, this is the role of the church. We are supposed to be ministering to those in need. So our churches should probably step up the game. So have Celebrate Recovery or some other recovery group. Have accountability opportunities. Have small groups with strong boundaries. The woman with the mental illness that I consulted with in preparing, she said, it's not okay. I could come in and dominate the entire group week after week after week after week. They have to have strong boundaries so that one person isn't sucking all of the energy and resources from the group. So small groups with strong boundaries. Finally, there should be no taboo subjects. Somebody said that a pastor who can talk about suicide can change the landscape of a church. We need to be able to talk about stuff. It's the sick that need the doctor, not the healthy. So no, we don't talk about those things in church. Oh, if you have a problem with pornography, I think that person over there might be able to help you. No, let's be talking about these things. They're sin issues. Why aren't we talking about them? Pastors, this is a challenge for you. Are you calling your communities, your congregants, to discipleship? Because that's what this is. Are we taking people under our wing? Are we discipling them? And finally, I think that there needs to be room for every part of the body. What is God doing in the midst of somebody who's struggling with mental illness? Don't write them off. Look for how God is working in them. Can they help? Can they serve with something? Can they work? Can they do PowerPoint? Maybe they're not prepared to teach, but can they help with the PowerPoint? Can they help with sound? Are they able to help set up, to break down? Can they share their testimony, what God's doing? Maybe they are ready to preach. Who knows? Let's take the time to get to know people, make room for all parts of the body, and let the church be what it's supposed to be, a place for everybody. Thank you very much. Move on. Okay, so now we're going to move into our little panel discussion. So we shared, like I said, nobody's getting a PhD today, so we shared some general ideas that we thought might be useful, but we know that everybody in here has specific questions. I think that some questions were collected.
Oh,
No?
no. Okay,
Okay.
so let me go over that.
Yeah.
Okay, so thank you, Alex. Let's see.
I know, that was good.
yeah.
You with the clinical stuff, you with the pulpit stuff. Sheesh. Wasn't that good?
Thanks, Yvonne. So let me give you, so here, you can ask questions, raise your hand, ask the question, there's no shame. We want this to be a safe place, so I can, if you're thinking of the question, I can guarantee you somebody else in this room is thinking the same thing or has thought of it before too. And we're all here to learn. There's no judgments or anything. That's how we're gonna be able to overcome the stigma of mental illness. Is we need to address it, talk about it, get it out in the open. There's no shame, again, like I said, and so. But if you feel more comfortable being anonymous, there's another way we're gonna do this. So instead of index cards where you have to write down and somebody walks around and you hand it to them because then that kind of points you out that way too. Use your phone. See you can text, there it is. Text that stuff, that's my number, my work number. And my husband, who's gonna be sitting there, he's gonna have my phone. So you can text your question to me that he's gonna get. And don't worry, I don't know you, or actually I do know some of you, but I didn't save your numbers to that phone, so I don't know. You won't be identified. And he has a microphone there, and he's gonna ask the questions as they come. Okay, so I know you guys all have phones. And so you can be thinking of your question right now, and some of you who walked in late and some who were here and maybe you just need a refresher, we can reintroduce ourselves again, just to give you some time to think about your question or text your question.
Okay. So to reintroduce myself, I'm Alex Love, and I'm a licensed marriage and family therapist and a certified substance abuse counselor and sex offender treatment professional. And I have a private practice in Wailuku, which I do part-time. And I see folks that are adolescents to adults, all sorts of challenges, marriage, anxiety, depression, the run-of-the-mill stuff, and also, but mostly men who have sexually offended others.
Thank you. Okay, and as again, I'm going to mention, feel free to get up, get something to eat, drink, use bathroom outside anytime. So I'm Mari Kanemura. I'm a licensed clinical social worker, and I work at the UH Maui College as a personal support counselor, offering counseling and psychotherapy to students. They are often in crisis. They're sometimes can be suicidal, anxious, depressed, and or in domestic abuse situations. But I also have a private practice and work for a Christian clinic called Oloho Clinic that's based out of Oahu. We can put it on vibrate. Yay, questions are coming. And but yes, so there's Christian psychologists on Oahu. And I'm here on Maui. My specialty, I guess I would say, is with women and with children and adolescents. with survivors and victims of abuse, trauma, and the areas of grief and loss and adjustment disorders.
And I'm Yvonne Manupuna, marriage and family therapist. My jam is really relationships and couples work. But I've also worked in women's substance abuse, residential substance abuse, and then with adolescents as well too. That's the population. But you know, a lot of our work is depression, it's anxiety, it's, you know, disorders that run the gamut, really, substance use and all that jazz. But that's my preferred.
Great,
people.
thanks. And I also want to add that we're all licensed. So the nice thing is that, you know, like psychologists, we can accept insurance. There's a misperception that, you know, how much does it cost? Well, it costs the same as if you were to go see your doctor. It's a copay. So
if I can add that we're all Christian too. I think one of the, you know, the goals of this panel, the workshop thingamajig, is to bridge the gap between the church and the mental health community, right? So I think the church, you know, we are the best when it comes to accepting people, when it comes to support, when it comes to loving on people. And if there's a way that we could do that as mental health professionals and in the different churches, my good friend Sally Englert too, she's a licensed marriage and family therapist. She does trauma, women's issues, that type of jazz. So we've got a rich community of mental health professionals. And if we can just kind of, you know, connect it with the churches and go, hey, you guys don't have to do this on your own. We can support you guys as well too. How do we get that conversation going? I think is, and we got different kind of churches too, yeah, here as well.
Good, thank you. Okay, so let's start firing away. Did we get it?
Sam has a question.
Okay. Wait. I want to get your question in. Can I just walk to you? You're trying to text.
I'm
Okay.
so slow.
Alex, were you talking about me in church? I knew it.
You coming up on stage,
Yeah,
grumbling?
there's no snacks.
Yeah.
I hate this place. My question is, how are people in your field working with public education and our government to bring policies or education to the general public?
We try to stay out of politics.
Good question.
Sorry.
Oh, you know what? I
That's
forgot
you
to
guys
mention a disclaimer. Because if we don't know the answer, I'm going to throw it back at you guys.
Yeah, what do you
Just
think?
kidding. No.
Well, I know that on Oahu, I worked for Hinamauka. It's a drug rehabilitation center. But they had another wing or a branch of their organization called Teen Care, and that's who I worked with. And we were in the schools and provided confidential substance abuse treatment during the school day for students. So it's cool, you know, instead of going to art, they'd come and get some therapy with me, with individual and group therapy. And we had after school activities that we would do. We'd take them ice skating, or they wouldn't let us do beach stuff, but we did do camps overnight, and it was really cool. Actually, one of my coworkers was a very, very bold Christian and an intimidating woman who I think our boss was a little intimidated of. So she was getting people saved at those camps, and our boss never said anything, I think, because she was nervous. But so we can sort of weasel Christianity in certain ways. I don't know if that fully answers your question. Doesn't answer it?
Your question was about the clinician's role in school education system and government. So organizations, and how do they work with the schools in bringing more awareness? And then the government piece, how are they for funding? Oh, okay.
For myself, honestly, right now I'm in private practice, so it's not community agency work right now. I used to do community agency work, and then and then I just moved into the private sector. But when I was doing that kind of work, I mean, gosh, we were at the county council meetings. We were, you know, speaking on behalf of women in addiction to get some funding. Your grassroots communities do a really good job at kind of making their voices known, raising some funding, that kind of stuff. Me personally, right now, I'm in private practice, so I'm not necessarily on the front lines of that. But you can bet when there's something that moves me and I feel called to, that I'm there advocating for it as well. That's just me personally right now.
No, that's good. I'm trying to think of, oh, you know what came to mind was there. It's kind of like this mentoring, big brothers, big sisters. What was that one called? J. Jarman. Common Grace. Common Grace. I don't know if you heard of that, but they do it on Oahu, and it's you guys know about what Big Brothers Big Sisters did. So there you can volunteer and be a big brother or big sister, and you kind of mentor like one of the elementary troubled children at that. Depending on what their background situation is, like they just having an advocate for them to just hang out with them after school and do fun stuff and be a good role model in their life. That's what Big Brothers Big Sisters is all about. Well, there's actually a faith-based organization, much smaller than Big Brothers and Sisters, but they're called Common Grace, and it started with a church, and it grew, I think, to other churches that are church members that are doing this in the public schools. So there's that bridge of faith and the church getting into public schools. So it's really, really cool. And I think a lot, like the organizations that Yvonne mentioned, like it's the grassroots kind of smaller ones that are doing stuff. Like Made in Hope, they give out backpacks full of school supplies in Waipahu for free, and have this big fair for the community. Anybody can go from anywhere, and just trying to again like encourage and inspire and bring hope. The government funding, I think I know like with Made in Hope, there was some grants that we got to do things, programs like this, but it's, I guess, it's not, I wish there were more. Okay.
Do you guys know about National Alliance on Mental Illness, NAMI, at all?
NAMI. I heard of them, but do you have more to add to that about NAMI?
I think there's a chapter on Oahu, but actually, if you connect in with NAMI, they have programs for free for people who need different counseling or support groups or whatever, that kind of thing. So yeah.
Thank you. Is it Christian? No. Okay. It's a national organization. Okay, great.
My question is on page 3, number 21. I would like to have some examples on these disorders, because to us, it's part of life. It's a normal life to us. So I would like to have, some example for each disorder, so I can recognize that, it's not part of life or normal. Okay.
Oh, you have a question?
I think one of the way to determine whether something is just a normal transition, you get dumped and you're depressed. Your mom dies and you go through a period of grieving, and that's all normal. I think where we determine that something is a disorder is when it's causing significant impairment in somebody's life beyond what would be normally expected. We all grieve in different ways. We all have anxiety, how am I going to pay that bill, or am I going to get my kids to school on time? We have those types of normal things. Are you anxious about everything all day long? Does it keep you from doing things that you used to enjoy doing? Are you so depressed that you're struggling to get out of bed, or that you can't go to work, or that you're getting complaints about you because you're making errors at work? beyond what most people would expect considering your situation. A panic disorder? Okay. Does anybody, I can give an idea, but if somebody else wants to
Usually, if I'm like in my office, I whip out this book that gives like a list of things. So I can't quite say off the top of my head what panic is. Yeah, I know.
talk. So a panic.
But if I can just kind of backpack off of what Alex was saying, you know, a lot of the stuff that Mari was talking about, we can all relate to some degree to all of this stuff, right? We've all got some of these like lingering depression or anxiety. Like I got 3 kids, a 3-month-old. Talk about depression. If you're not getting enough sleep, you can experience symptoms of depression. Now, I'm not a full-on diagnosis of depression necessarily, but so you can, like, we can give you the criteria that meets panic. But if you're looking to see if I got a panic disorder, that's not the best way to go about doing it. And here would be a case like she was saying, like if you can't go to work, you're feeling panicky because you can't go to work, or you cannot play out your role as a mom or auntie, or you can't even get in the car and start driving. You just start feeling panic feelings. That's when I would just go trigger or like flag that and go, maybe I should call somebody up and see if what I'm feeling is normal, yeah? So again, if you can't carry out sort of your day-to-day activities, then I'd be concerned about it. But for the most part, if you got a 3-month at home and you're depressed because you haven't got enough sleep, you're probably good to go. Yeah.
And we can talk more, you know, if you want to learn specifically on that maybe after. but I did, yeah, just kind of want to reiterate what Alex is saying and Yvonne, that you know, we can all fit ourselves into everything in the DSM. So there's a little bit we carry on that, like it's gonna come back where life happens, and so you don't want to box yourself into or fall into that thinking like, oh my gosh, I must be that, you know, because of this. But it's exactly kind of what they describe, that if it has to be debilitating, it's just consuming, it's affecting your daily functioning. You wouldn't be able to sit here if you had panic disorder. Mm-hmm. So having panic attacks is different. You know, just like even having a drug like or substance abuse, substance dependence. You know, there's a difference there too. Mm-hmm. Okay. So, but I do want to go back and forth between hands and text questions. So let's get the next text question, please.
Okay, the next text question was, what is a way to lovingly set boundaries with someone you are coming alongside to help and be there for?
Okay, setting boundaries lovingly with someone you're trying to help. I know when Alex is talking, there was something I wanted to point out, that she talked about getting help. You don't have to do everything, know all the answers. I'm all for that. I mean, social work, come on, we're about resources. I want to plug them into the right like services and support. There's nothing wrong with calling the suicide hotline. Like they know how to handle that. You know, you don't have to be the expert. And so it's the boundaries is I think knowing your role. Like, what are you, friend? Are you sister? Are you just pastor, or well, just you be that. Like, that's your role. You don't have to be anything beyond that. You know, that friend or that person who needs you to come alongside them need you for that, not to be those other things. You know, that's when they need a doctor to be the doctor. They need a social worker to be the social worker. You know, I was thinking of when I used to work in all the hospitals in ICU during a time of for organ donors. So these families just lost their loved one. They're still in the hospital bed on mechanical support. We don't call them life support because they've been pronounced brain dead, but traumatic, sudden, unexpected brain injury. And these are families from all over. So everybody had, death affects everyone. Doesn't matter what you do. And so there were families that had, they were professionals, or they were in the medical field themselves, and like a nurse or something, and they're trying to intervene for the family and be both roles, like trying to be daughter, but also interpreter and nurse. But it's like, which one do they be? Which one do they have to do all of that at their time of loss too? Like, no. So like I would step in and it's like, no, you just be daughter. That's in this. You can be nurse when you're working. You can be interpreter in other situations. I'll get another interpreter because you want them to be able to be present. That's how you can walk alongside, I think. Anyway, someone.
I think another common way that we see boundary violations or pushing of boundaries is like, somebody might be asking you for money all the time. I just need $20 so I can pay my phone bill. Or if you could just give me a ride. Or I need a place to stay. Can I sleep on your... I don't mind. I'll just sleep on your couch. And so the first thing that I think is, first ask God, what is your role supposed to be? I had a need to feel important and needed. And so I ended up being sucked into all these dependent people's lives. So I would get text messages in grad school, like 1 a.m, do you think I have a dependent personality? I'm like, yeah, but I can't say it because I have bad boundaries. Or like people texting me, hey, does our health insurance cover chiropractic care? I'm like, I don't know, let me look it up for you. Instead of giving them, like putting the ball back in their court and saying, well, why don't you, here's where you can find that information, why don't you go ahead and find it? People asking for money, I think it's important to ask yourself and ask God, am I actually helping them or am I enabling them? If I give them a place to stay, does that help them long term, or do they need to experience the consequences of some of their choices so that they're uncomfortable enough to make a change? Yeah. And the way that you go about, so that's how you make the decision, but how do you lovingly create the boundary? Maybe pull them aside, honor them, and have a real clear, blunt, caring conversation with them. My husband's got the gift of correction. Like, he has this way of being like, that was a really bad idea, don't ever do it again. I love you and we're best friends still. I don't know how he does it, but he does it. But that's the thing. You talk with people, you let them know that you care about them and that you're concerned that if you help them with this thing that they're asking for help with, it doesn't actually benefit them and it doesn't actually benefit you, and let's come up with a different way to handle this problem.
Cool, thank you. Let's do the next text question since I did a couple of audience.
So the next question is, at what point does someone call for help with someone discussing suicide?
I couldn't hear. Yeah, can you try again?
At what point does someone call for help with someone discussing suicide?
Tip them.
Yeah.
Time.
Put it down. My battery is dead. Is it?
So there's an acronym,
Hello?
TIPM,
Hello?
time or timing, intention, means, and plan. So is this person saying, I think about suicide? You don't need to get on the hotline for something like that. Sometimes I think about killing myself. You don't need to get on the hotline for that. But do they have a time frame? I don't know what I'm doing here. Do they have a time frame? Are they saying, this weekend I'm going to kill myself? And if they're saying that, do they have the means? Are they saying I'm going to shoot myself, but they actually don't have access to a gun? Maybe that's not something you need to be quite as concerned about. And then do they have a plan? So, I'm sorry, it's not time. It's thoughts, intention, means, and plan. Are they thinking about it? Are they intending to do it? Do they actually have the means to accomplish it? And do they have a plan for it? So for us, if somebody comes into my office and they're like, yeah, I think about suicide, I'm not worried about that. But if they say, like, yeah, probably by the end of this year, I'm a little bit more concerned. If they say, well, I think when I leave this office, I'm gonna do myself. I'm gonna do it. I'm getting on the hotline. I'm calling for help right there.
TIPM, thoughts, intention, plan,
Means
and
and plan.
means. Whoopsies. Means and plan.
Tip 'em. I'm sorry.
Tip 'em.
Plan and means.
Whatever. The thing is that you
yeah,
remember
you're
tip
right.
'em. Do you guys have the access hotline number? It's on my phone on like speed dial because it's what we do.
1-800.
But do you guys want to know it? Yeah?
Hello. Okay.
Does anybody have? I can grab my phone. Hold on. Because with it, if ever in doubt, just give them a call and just go, hey, this is what I do.
Yes.
Like
Oh,
with
thanks.
even. Oh, you got it?
Okay. And then you also, I think, sometimes there's this perception that I don't want to ask them and give them the idea, but
thank
actually,
you.
like you have to ask them what's your plan, because they already have it. They don't need your help. They've have all the time to think about how they're going to carry out their plan. So yeah, that's when it gets really serious. Yeah, if they have a plan and access to carry out their plan.
Okay, are you ready for the number? It's 1-800-753-6879. It's the access line, then poison
something
control
to
I have
add
as
to
number
that.
2.
Suicide one. Okay.
With
And then
kids.
I have another question.
Right? Did you get that? Yeah, so ever in doubt, just give them a call. But tip them. Thoughts, intent, plan, and means. I just never had an acronym for it. Tip them.
Okay, I have something to add to that suicide one. I know somebody that calls every now and then to his ex-girlfriend saying, I'm going to kill myself. But I know him a lot better than he knows himself. And when I talk to his ex-girlfriend, I go, so does he need help killing himself? Because I know he's scared of death, so he ain't gonna kill himself. The thing that triggers him off is he wants pity, which I won't give him that. I'm talking about my son. He wants pity, he wants handout. I'm not gonna hold his hand because he's old enough to hold his own self up. But at the same time, if anything does happen, at least I know where I can call to get somebody to go help him. My question is about bipolar, number 11, overlap of depression. Is bipolar and depression similar in most cases? Because I know a lot of people that goes to the doctor says, they tell a doctor they're depressed of certain issues. Doctor classifies them as being bipolar. Would that be similar in that area?
Yeah, the bi is the two experiences, depression and mania. So it's within the diagnosis. Yeah, depression is part of bipolar. But you rotate between the two. And there's bipolar 1, bipolar 2, blah, 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 blah. If you want to know more about it, we can give you a little bit more details. But yes, it is inherent within bipolar.
Right. Thank you. There's actually a lot of celebrities that are starting to come out and reveal that they are bipolar. Like Mariah Carey, I think was one recently, and Kanye West. But Robin Williams, he suffered from that his whole life. Yeah, and look at how talented, he was. And it's episodes. So one week they could be fine, and completely good, and like you see them and life is good. You can talk to them. The next week they could be down, and that's where it looks like they're in major depression because they are, or it could be anxiety, and then they start, distancing and just avoiding. So with bipolar, medication definitely helps, and even when they're stable, they still need to stay on the medication to help keep them at a stable place. Okay, text question? You have any more texts?
Yes. So, sorry.
Just one more thing about suicide and just your comment there about your son. So, suicide is not a natural to the human condition. We are designed to survive and thrive, yeah. So by the time somebody gets suicide or the ideas or thoughts of suicide, we're talking about like long-suffering depression. There's another mental health issue there, and that's another reason why I think we want to bridge the gap. We want to recognize some of these symptoms, because we don't just one day wake up and go, I'm just going to kill myself, right? It goes against who we were designed to be. So if we can recognize sort of the long-standing depression, perhaps, yeah, if he's making, saying these kind of things like, I want to kill myself, and we might need to address something that's not really the suicide, the underlying, maybe the depression or anxiety, probably a combination of both, that kind of stuff. Yeah.
So it's a multi-part question, I guess. It's a couple of people's questions I'm combining.
Okay.
So one is, how do we get evaluated for depression now that we've been here? And do we see a regular doctor? And then second part of that question is, that whatever we don't have insurance, what's the process?
If getting evaluated for depression, actually a lot of your doctors, a lot of them do that regularly now. But there's this tool that I use called the PHQ-9. You can look it up online, and you can take the test yourself too. And it's only 9 questions, patient health questionnaire, and it asks you things about those symptoms, basically. How often do you feel down, depressed, or hopeless? Do you feel like you're a failure? And it ranges from none to, I think, a few times or several times a week to always, and it's all in the last 2 weeks. And then you can score yourself, and you can see where you fall, from moderate to severe depression, and what the recommendation would be. So that's one way, but you can also go to your medical doctor, definitely. Anybody want to answer the second part?
If you don't have health insurance, I know that there are a number of mental health professionals that offer sliding scale fees. So I see people from YWAM. They may be international, and they don't have health insurance that works here that I accept. And so I see them for nothing or for a very small cash payment. I'm sure that others do the same.
Hawaii is number one in providing health care for their people. So why don't you have medical insurance?
That's a good point, too. Yeah.
It's easy to get. It really, for the most part, is really easy to get. So, and we can help you with that stuff, or even a community agency are all about getting health care for people. Yeah, because not just for the mental health issues, your physical health as well too.
Yeah.
Thank you. Any questions out there, or otherwise? Sam?
3 minutes, I think. Sorry. What was my question? Oh yeah. So do you guys all go to church? So in your churches, what would be some organizational things or maybe logistics that you would shift or change or remind church people to be more aware, to cater to mentally ill people and help them feel more comfortable and safe?
I think that's why we're starting this kind of thing here, to start the conversation about it. That's at least my way to do it.
If you're head of the church, what would you do? Okay.
I think that it's great to have a team trained to de-escalate situations, so that when we have somebody come on in and they're behaving in a way that is not suitable for church. We had a woman come in one day, and she was touching herself sexually in the front row, and eventually went out, and my mom had taken the baby, she was a newborn, had taken her outside, and so I was like, oh, I better go check on that situation. And my mom was coming in, the woman had urinated on the sidewalk and then took off all of her clothes and was standing on a bench naked and yelling while one of our young men was trying to pray for her and like do deliverance. Doesn't look good. So I was like, oh, one of our volunteers was like, oh God, put on your clothes. You're so freaked out. So having people that know how to respond in that situation and can step in, that young man, his heart was right, and maybe that was, I don't know, maybe that was the right thing to do, is take that opportunity to pray, but she was outside with only men. That's not a good situation. So I just stood out there at least so that there's a witness, because people driving by, that doesn't look good, right? You got a woman yelling on a bench and she's naked and a man looking up at her. That doesn't look right in front of a church. So having a team that is trained to de-escalate, they know, we know who the guy is or who the woman is that's going to step in that situation. Candace is really good at that. She'll go over and, kind of encourage people to maybe have a seat or step outside or let them know that she's there for them. You don't want the hothead is probably not the right person. Like, hey, get out of my church. No. And then for, ongoing care, again, some people that have a heart for it, maybe have some training, if they're lay people, some training, and know what we're looking at, what disorder we might be looking at, and what the right way to suit that is, so that they can get them connected in the church. I think that the church is the place where this is supposed to happen. And I felt really convicted recently when I realized, gosh, if somebody in my church came to me and asked, who can I go to for counseling, or where can I go for substance abuse treatment, I would refer them to community agencies. And that's not bad, but isn't that what the church's job is supposed to be? Right? So that's one of the reasons that I do, cheap or free therapy for people that need it. I know that there are other people that do the same thing, but I don't want cost to be an issue, and I think that some people don't need professional treatment, but they need connection with other people who understand and have boundaries and can help walk them through stuff. That's supposed to happen in the church.
And that's great. I think having a plan for crisis, definitely. But I like to see, I like relating to other people. So even like hearing stories being shared in church service, or testimonies, where we bring this conversation, any kind of mental health subject, out in the open, so you kind of normalize it. It's like, it's not just something we hide and only certain people have to see, professionals or counselors. It's like, no, this is all of us. We all go through things in our life, and so even our pastors on Oahu at our churches there, like they some of them they're transparent about like their depression, and it's like, wow, I'd never guessed that or know that. But when they're able to kind of role model that and be like, yeah, this is where I'm at, but this is where I struggle, and talk about it, and it kind of I guess just again like normalizes, takes that stigma away, and I said there has to be a shift in the church. All these controversial topics, like I want to bring it back to the church in discussion, integrate it into the conversations every day, so people don't feel like they have to put on their mask. Whoa. When they go out, when they leave their house and go to church, like you want a safe place. We had a soul care group where it's like, it was about that. Like, you want to take off your mask and be who you are, be yourself, and without any judgment. So that's the other thing is, just that's how you create that safe place, I think.
And when people are uncomfortable, because I know that that's a concern, it's like, well, we don't want everybody in church to be uncomfortable because this one person is here. Encourage them to be comfortable with being uncomfortable. And when people are saying, well, I don't want to go to that church because there's like too many homeless people that come in there. Oh, stop it. That's what the church is supposed to be for. So let's encourage people to be like, remember that this is church. And it's not where you're supposed to feel comfortable. And we aren't supposed to tolerate like unsafe situations. I'm not going to be like, well, if you want to go hang out in the nursery with all my children. No, but we need to create places where people are welcome to be and where we can deal with our own stuff and not make people feel like if you can't show up and act right, then you shouldn't come to church at all.
How are you doing on time, you guys? It's 11:05, but we do have, I think, like 5 text questions. I told Chris to just read it all, all 5 at once. Feel free to please. I mean, we can yeah. I mean, we maybe like a few more minutes. Okay, sounds good. Okay, go ahead.
Okay. Well, the next question is, are there any practical ways you can suggest to encourage a person when they live off island and do not know Jesus, family member? Okay. Are there any practical ways you can suggest to encourage a person when they live off island, do not know Jesus, family member who's bipolar or depressed, manic, when they're not present here?
Yeah, I think, this is also one of those questions of like when people are ready to change, kind of a deal. Yeah. We can try to assure safety, that we give them some resources, but you might have a situation with your friend somewhere in the mainland or whatever that they've not experienced the need or desire to seek out change, yeah, or healing or whatever. And that we kind of back off and give them the opportunity to do that. Next.
I have another one referring to depression. Can someone prefer to stay depressed?
Well, it's a bummer if you do.
Well, when I'm looking at how to change with people, I like to look at what opportunities does staying the same allow? What risks are associated? What are the benefits of not changing? So maybe a benefit of not changing is that it's just easier. Maybe they're discouraged. They don't think that it's going to work out. So I think to answer the question just short and sweet, sometimes there's something working for them in the depression. They don't have to have a job, or they get people that are concerned about them and let them know that. So if we can figure out what's the underlying need that they're trying to meet, and then what's the healthy way to help them to meet that need. Yeah.
I lived with depression for a few years. Went to the doctor, told him that I'm depressed because I'm home by myself. My husband was working at that time, and he gave me some medication for depression. As the years went on, my life changed to where I was 410 pounds because my favorite pastime was the refrigerator, easy access, find something that was junk food, not good food, pastries, candy. That was my weakness for depression. And it filled me. But then I hated myself. I hated myself to the point where food was my best friend. Talking to my husband was second, but then I hid a lot of things from him. As the years went on, I was introduced to Huinoke Olapono. They helped me lose weight. I lost all that weight, plus just over 6 months ago, I lost more weight. Now I'm 255 pounds. 5 years later into it, it's like I'm not depressed no more. So you can overcome depression if you want to, if you choose to. But if you still want to stay on depression, then that's going to be your friend the rest of your life. But if you choose Jesus Christ over depression, then that's who you're going to walk with, the Lord.
That's good, thanks.
Oh, wow. Amen. Great support.
Thank you for sharing so much. I want to add, if you do need to leave, can you guys fill out those evaluation forms too? That's really important for us. Feedback. We want to know. We want to do something like this again if there's an interest, and what topics you folks would like us to cover.
Okay, it's the last question is if I've been hurt by clergy or leadership in church and not communicated that with them, what is the process and how do I go about talking to church leadership if they're the ones that have hurt, and then do I go and seek help outside?
I love this question. If I can get, I'm just going to have Sally kind of chime in on this one. She does sexual assault work. Sir Jam.
Yes, thanks. So I work out of Hope Chapel one day a week and do a private practice, but I've been working with sex assault survivors and survivors of interpersonal violence, same thing as domestic violence, for a lot of years. And it's interesting because I identify as a Christian, so I've worked with lots of Christians in the secular field, and then now doing private practice, I'm doing Christian therapy with people who want to do that, and then trying to bridge the gap a little bit. And so that's, I think, a big part of the conversation is that oftentimes the church can be uneducated, and they have a good heart to help, and they want to be helpful, but they maybe give advice that's not safe or that's not supportive just because they don't know better, right? And then it's a barrier for people to get the spiritual care that they need while they're trying to heal. And then on the other side of that, sometimes people are going to community professionals that are not faith-based, and they identify as a Christian, and they are getting really good quality services in terms of their mental health or in terms of their recovery, whatever that is, but then they feel like their faith isn't being respected. So then it's a big barrier. So maybe they don't want to get the professional help that they need because they're not feeling respected. So there's sort of this like go-between issue that comes up for people. And it's really common. So conversations like this, I love. I'm so excited that you all are courageous enough to be here and to want to learn more. This is something that we've been trying to do at our church at Hope Chapel for the last maybe 5 years, is to do ongoing trainings like this with the staff, and then ongoing trainings like this with the congregation. Then it morphs into more specific areas or whatever. And the reason why we keep doing it with the staff is because it's really messy. So it's easy to like say these things and how to identify it, and then when it gets into practice and you're like dealing with families that have abuse going on or mental health issues going on, and then like how do you care for every single member of the family, and what does that look like? And we're human, and so pastors hurt people, and people in the congregation hurt people, and professionals hurt people, and even when we mean well, we can hurt people. And so I think it's really important for people who have been hurt by somebody in leadership to have that conversation when they feel ready. So maybe a little bit of healing needs to happen first. I don't know what the context of that hurt was. So like if they were actually like physically abused or sexually abused by somebody, I would not suggest directly confronting that person right away. Talk to a qualified mental health professional that specializes in the areas of abuse to process and talk with you, and get yourself to a place where you're ready to talk about your story, if that's something that you choose to do and feel led to do. But if it's something where they have hurt you emotionally, I think they can really benefit from knowing about that. Oftentimes folks don't know about that. And those are really hard conversations to have. And so if you feel comfortable and you feel ready for it, gosh, like how much healing can happen in the church if those conversations happen and you have the courage and the ability to confront that staff. But do it with somebody else. You know, your story is so precious. Your heart is precious, your healing is precious, and so I just encourage you to bring someone with you, a trusted member of the congregation, another pastor into the conversation, and try and move through the messy, because I think that's where Satan gets a foothold in a lot of this stuff, and creates that division, that isolation within the church and the community, within the church itself, all of those, and within our church communities, whatever. So yeah, that's a little bit of, hopefully answers the question, but it's also kind of why I'm here and what my heart is to see that bridge gap, or that gap bridged for Christian survivors specifically.
I also think that sometimes when people have been hurt, they just will go to a different church. And then they'll get hurt there, and then they'll just go to a different church. And so we see people bouncing around, and it's Maui, so then they end up circling back around. So we know some of those people who probably continue to get hurt and may just need some support in learning how to resolve conflict. So that's why I really like what she said. Take somebody with you if you're not comfortable to go and talk to somebody on their own. But this is where iron sharpens iron. So it's scriptural to go to somebody and resolve conflict if it exists.
Okay, thanks. Thank you so much. Thank you for joining us.
Sorry, I know you're on a time crunch, but thank you for everything that you guys have been sharing. I'm actually was a victim of domestic violence, and being a Christian, I came to the Lord at the age of 7. My first marriage was at 26 years old. My first kiss was at the altar, so I waited. But it was a nightmare on the first night. So having gone through that experience, and I was, missionary, being active in ministry. My ex was also active in ministry. He was in children's ministry, adult ministry, you name all the ministries, worship ministry. But people would never think that this would happen in the church. And there is a lack of connection between the church and things that happen in our society, and things that happen because of our human sinful nature. But I praise the Lord that I went through depression, I went through suicidal thoughts, I went through the church turning against, I went through rejection from family, I went through all of the above. And a lot of the things that you guys talked about. But the Lord is faithful when we turn to Him. And I know that it's a big thing to say, don't just trust in the Lord. I had that said to me a lot of times, like, what does that look like? And for me, and personally in my experience, it looked like, thankfully my parents are also Christian, and they came alongside me to the point where there are 4 churches turned against them, supporting them as missionaries. So they lost their support, and the very next month that they were going to need support, another church, one church, from 4 churches supporting to one church just coming in and providing that need. But my parents came alongside me, and sometimes it takes for the person that's outside of a trauma experience, trying to help a person that's in the experience, prayer is definitely important. And being there, sometimes just reading scripture to them. My parents read scripture to me, not necessarily with any end of me responding, just reading it to me. And listening to a lot of teachings online from pastors, but the Lord is faithful to come and bring that healing. And praise the Lord, also that connection from the churches that did kind of excommunicate in a way. Years later, seeing that my parents' walk in their faith with the Lord and my walk, it wasn't faltered by, now I understand, is like don't allow yourself to get bitter towards the person because they don't understand. So just be in prayer that the Lord will guard your heart through the situation, and not to talk bad about the church or the pastor or the leaders in the church, but to just keep it in prayer and pray for them. And thankfully, in doing this, years later, 2 of the pastors out of the 4 churches actually apologized to us for not understanding and for not having that heart in what the situation was. So it was a beautiful restoration, and even in family. So sometimes family doesn't understand, and I've experienced that restoration within my family as well. So I don't know if it's just a testimony. And I'm in ministry now, New Creation Jiu-Jitsu, and we have experience with ladies. I always question, why, Lord, why would you allow this to happen to me when in my mind I did everything right in the book, right? But he's given me a lot of opportunities to be able to share with women that have experienced domestic violence, rape, verbal abuse, emotional abuse. So it's been a blessing to be able to now stand on the other side of healing.
You said jujitsu.
Yes.
Well, this is karate. Jujitsu. Wow.
Thank you so much, Yoli, for sharing. Yeah. I just thank everybody for just being so open and honest, and this is a safe place, and I hope that God just touches your heart and reaches you today, met you where you're at. So, but we are over time, and things that I wanted to emphasize, just to keep the conversation going. Keep it going at home with your friends, at church. You guys are all leaders. That's why you're here. And when you open up like that, the other person's gonna open up too. So there's so much power, and you're taking away that power of whatever that was that you kept trying to hide. You're taking that away, and you're saying, you're giving it to God, and you're glorifying Him. God is using you. He's using everything, every hurt. He's using every broken piece, and he's going to use it for His glory, and that's how He redeems, I believe, like every part of that pain. So definitely today, self-care is super important. I'm gonna need it too. So take time and do something nice for yourself today, and keep it going, every day. And finally, I guess, again, if you can fill out those purple evaluation forms and maybe turn it into, you want to collect them too, Chris? You can turn it into Chris over there. You want to say something? Oh, sorry. Go ahead. Oh, okay. I think that, again, like any feedback, suggestions on topics you're interested in learning more about. But yeah, go ahead.
I just had a quick announcement, so thanks for letting me hijack this a little bit at the end. But in October, I'm going to be hopefully hosting and facilitating a training and conversation with the different faith leaders on Maui, Christian or non-Christian, welcome, and different service providers that work with trauma and abuse. So prosecutor's office, Maui Sexual Assault Center, and the Maui Police Department, all the different specializations and areas, child welfare services, and I'm hoping to have all of the people in a room, which is a little bit scary, because there's some division there, right, and lack of trust, but I just want to start relationships and let the church see a little bit about what the professionals do, and start utilizing and accessing services, let the service providers see what the church offers, and just start to build that partnership. So if your church is interested in participating in this, or a ministry that you're involved in, I have a little email, phone number, sign-up sheet, and I'd be happy to include you all. So, yeah, in October.
Awesome. That sounds really good. Okay, so I think we'll just close with prayer. Yeah.
Just curious, to me, like I was saying, this is just opening the conversation up. This is not the end of anything. At least in my mind, there's a lot more that we can discuss. I'm just curious right off the top, of those of you who are here, is this something you'd be interested in reconvening again? Doing something like this? Okay, good. Okay, I'll just leave it at.
Okay. Well, yeah, we definitely want to thank you, Pastor Kaleo, and thank Gap Church for being willing to host us and for the idea. This is really cool, and I think I'd love to be a part of something else in the future. I'm sure that others would too. So yeah, let's take some time to thank God. Yeah, we thank you, God. We thank you for opportunities like this to get together, that we live in a place where we have a lot of needs, and yet we have hearts that are open and would like to serve. And so, God, we ask that the information that was delivered today would sink into people's hearts and minds, and that it would be able to be accessed in the future when something comes up. Lord, we thank you for connections being able to be made, and that there are people in your body that care about these types of things, and people that are sitting here in this room that are passionate about serving and loving others who might be hurt or hurting. Yeah, God, you're a good God. You are a God who saves. You're a God who restores. And so for everybody in here who's here for a family member, a friend, or a loved one, and they have hurts that they're dealing with, Lord, I ask that you would begin that restoration process. Strengthen the people that are here and on the front lines and dealing with these issues. Let your face be known to them. Amen.